Dr. Kurth here over at Queen Creek Veterinary Clinic, and today we're going to be chatting about valley fever. Valley fever is super common in this area. It's all over Arizona, but especially common in Gilbert, Queen Creek area. It's a fungus that's everywhere in the soil, and the hard part is that not every dog is going to get sick from it. So some people and animals inhale the fungal spore and nothing ever happens, or they have very mild illness. But for some unlucky dogs and people, you can get really quite sick from it. Most common signs of valley fever in the dog are cough, fever, loss of appetite, weight loss, but it can also do some really bizarre things such as cause limping, it can even cause seizures. We've even had some really weird cases where it just causes eye problems or just causes swollen testicles or things like that. So it can kind of do whatever it wants. The most common way we diagnose valley fever is with a blood test. So we do what's called a titer, where basically we measure the amount of antibodies to valley fever organism in the body, and that gives us kind of an indication of whether we're having an active infection or not. It's not a perfect tool though. There's some reasons why your pet might test negative, but still really have valley fever. And so there's a couple ways to diagnose it if our blood work is not as helpful as we'd hope. One of those is by using clues in other routine blood work. So certain changes in white blood cells or protein levels can also be really helpful in helping us make an educated diagnosis. Using x-rays to help look for certain lymph node changes or bony changes are sometimes very helpful. And then a lot of times we are using a CAT scan, biopsy, that sort of thing in really difficult cases. In some cases it's so difficult, but your veterinarian might be so suspicious, but we just can't prove it, and so we might even try something like a trial of fluconazole, which is the treatment for valley fever, and if the pet gets better, we kind of use that to support a diagnosis of valley fever that way as well. Most of the time, I would say 90% of the time, we are going to start your pet on a medication called fluconazole. It's an antifungal medication, and typically we recommend treatment for a minimum of 6 months. However, this depends drastically from case to case, so the most important thing is definitely talk with your veterinarian. In some cases, fluconazole isn't the right drug, or there's better drugs, or we need something different, and so your veterinarian can talk to you about those options. And say that for the most severe cases, or cases where the pet just can't take oral medication for some reason. Definitely give it exactly as directed. Your pet generally will start feeling better within a month, if not completely better within a month. But so important to know that this medication only slows the fungus down, it doesn't kill it, and so your pet needs many months to actually completely kill the organism and get rid of the infection. And if you undertreat or don't treat for long enough, that's when it kind of can take over, spread to the brain, spread to the bones, spread to other organs that are much more difficult to treat. It is metabolized by the liver, so your veterinarian is often going to recommend lab work to check on the liver. Most pets tolerate it just fine, don't really have any side effects, but the most common side effects would be vomiting, diarrhea, loss of appetite. Rarely we'll get a pet who urinates more with fluconazole, and then very rarely we'll meet a pet who can't process it well liver-wise, and so the liver values become elevated and we need to find an alternative that's safer for that pet. So really important to do your best to keep up on the recommended lab work in general if we're recommending it, because we just want to make sure everything's going well and that your pet is safe on medication. Other questions I get all the time are, is there anything else I can do or add for my pet to help? There is some good evidence that vitamin C can help. The hard part is a lot of dogs don't like citrus, so if your pet is willing to eat oranges with you or take a vitamin C supplement that's considered safe, just chat with your veterinarian about the right dose. It is difficult to get cats to take vitamin C in particular. There are herbal and over-the-counter remedies as well. Desert Defense is a popular one. They definitely don't hurt. They might help. Definitely are never meant to replace the traditional therapies. We have pretty solid evidence that they just don't work well enough by themselves, but certainly they can help, support the immune system and may give your pet a little boost as well. Sometimes we add things like steroids to help with just inflammation, fever, appetite, that sort of thing. Generally not needed for long term, although occasionally we have pets who need them longer term. So those are some of the things about treatment.